Okay, so as I stated, my name is Caroline Black. I'm the Senior Outreach and Education Coordinator with the Oregon Health Insurance Marketplace. And today we're here to give community partners a better understanding of employer coverage and how that works with the marketplace. So a little bit on the agenda, we're going to talk about why you're here, things that you should know, what the offer of employer coverage is, how that looks with affordability and how that whole calculation looks, and how it applies to the application, and some other helpful tools that could be beneficial and useful when you're helping your clients navigate this process. So you're here to better understand marketplace topics in greater detail. The topics were voted on by community partners, and this was the first one that everybody would like more information on. And most importantly, it's to help you feel confident and comfortable with the marketplace subject matter. We want you to be successful and feel confident in the work that you're doing for the marketplace. And we appreciate that and just want you to feel confident. So some things that you should know when it comes to the employer coverage is, first of all, affordability rules have changed. A lot of people don't know that the marketplace is an option for them when they do have employer coverage or for their family members. Previously, if someone was found not eligible for financial help due to employer coverage, that may not be the case now, and they can definitely look into it to see if they would qualify now based off of the affordability rules changing. And with the changing of the affordability rules, it has provided greater access to affordable, high quality coverage through the marketplace. And it could impact financial assistance eligibility if someone is offered employer coverage, but it doesn't always impact the financial assistance eligibility. Generally, when a person is offered employer coverage, they are not eligible for that financial assistance through the marketplace to lower their costs. However, in cases where the employer coverage does not meet the minimum value standard and is considered unaffordable, they may qualify for that financial help through the marketplace, even though they're offered employer coverage. So what is the minimum value standard? The minimum value standard is a standard that all plans have to meet. And that means it has to cover 60% of covered services for a standard population. The 60% of covered services is equivalent to a bronze plan. Insurance company pays 60% of covered services, and the consumer pays the other 40% of covered services on an average. Now, in order to meet the minimum value standard, the plan has to meet both of that, covering the 60% of services for a standard population, and it has to provide substantial coverage of physician and inpatient hospital services. In order to meet the minimum value standard, both of those things have to be met. If one is met and the other one is not, or neither one of them is met, it does not meet minimum value standard requirements. Therefore, they could go through the marketplace and potentially qualify for financial assistance. Then there's also the actual affordability piece when it comes to the cost. Now, the affordability is calculated using the lowest cost plan offered by the employer for the employee only. And if the employee is enrolled in a higher cost plan, it's still the lowest cost plan that is offered that is used to determine what is considered affordable by the way the Affordable Care Act says it needs to be determined. It is a percentage that determines affordability, and that percentage is announced every July for the next plan year. For 2024 plan year, we were notified last summer that the affordability percentage that is going to be used to calculate is 8.39%, and that's the lowest that we've ever seen since the inception of the Affordable Care Act. Even if the employee only health plan is considered affordable, the family members could still potentially qualify for financial help. And this is the piece that has changed. So we're going to take a look on the next slide, and we're going to look at what that calculation looks like. So it will first look at the employee only. and it will take the employee's share of the premium for the least expensive self-only plan option divided by the gross household income. From that, you get the percentage. If it's 8.39% or less, then the employer-sponsored insurance is considered affordable. But if it's more than 8.39%, the employer-sponsored insurance is not considered affordable. If it's not considered affordable, they can go through the marketplace and potentially qualify for that financial assistance. Then it will take a look at the family plan. When the employer offers or extends the offer of coverage to the employee's family, it will take a look at what the share of the premium is for the least expensive family option and do that same calculation with the division of gross household income. And then again, look at that 8.39%. Is it less or is it more to determine whether or not it's affordable for the employer coverage? If it is not affordable, then the family can go through the marketplace and potentially qualify for financial assistance. And this is how it looks on the application when the application is asking these questions. It will ask, again, only for the employee, and then it will ask for the employee and their family for the family cost of the health plan offered by the employer. And it will look at the employee first, and then it will follow looking at the family. And then when it calculates it, if it's considered not affordable for the family can still go through the marketplace and potentially qualify for financial assistance. It will look back at the employee cost, and if it's affordable for the employee only plan, the employee would not be eligible for financial assistance through the marketplace. So it does separate them. It looks at them separately, and then it looks at them together, and then it separates them to see for the family to go through the marketplace and for the employee to stay with their employer plan. And the employer coverage tool has been updated to reflect the changes with the family glitch fix. And it's a very useful tool. It is not required, but again, very useful. The employer is the one who would fill out section 2 of employer information and provide the information on the coverage that they offer and what the cost is, and if it meets those minimum value standard requirements. That saves the employee time for having to go hunt that information down themselves. And again, it's not required, but it is extremely useful when they are offered employer coverage, especially when that employer coverage is extended to their family members. And that was really quick, actually. So if you guys have any questions following the webinar, you are more than welcome to reach out to your outreach and education coordinator. They are there to assist you. They're there to support you. And you can find who your outreach and education coordinator is for your area on our website. You can also email the cp.marketplace email box. Again, as you guys have heard in your training, that CP email box is for you to use to reach out for any questions you may have if you are unable to reach out to your outreach and education coordinator. And it looks like we have a Q&A. Will you guys get a copy of the presentation? The presentation, I do believe we will actually be posting them because we are recording them. We are going to post them in the TrackStar program, actually, that you guys use for your CP certification trainings with us. So I'm not sure how long it will take for that, but I can send a follow-up email to all the attendees today and let you guys know when you can look for that in the TrackStar. All right, I will let you guys have back the rest of your lunch hour. If you have questions, again, feel free to reach out to me, to your outreach coordinator, or the CP inbox. Thank you for joining, and look for a follow-up email for some feedback on how the information was provided today. Have a great day, everybody.